Diabetes is often referred to as a silent killer, and while many are familiar with its common symptoms like excessive thirst, frequent urination, and fatigue, there are lesser-known signs that can also point to the condition. These symptoms are often subtle, easy to dismiss, or simply go unnoticed. However, catching these signs early is key to managing diabetes before it leads to more severe complications. In this video, we'll explore 7 surprising diabetes symptoms you might be missing. The goal is to equip you with the knowledge to spot these signs and take control of your health before things get worse. So, whether you have diabetes, are at risk, or simply want to learn more about how this condition can affect your body, keep watching. 1. Gastroparesis, the hidden digestive struggle. Gastroparesis is one of those diabetes complications that doesn't immediately come to mind when you think about the disease. Yet, it can be a very real and troubling issue for those with diabetes, especially if blood sugar levels have been poorly controlled over a long period. Gastroparesis happens when the stomach takes longer than usual to empty its contents. This delay in gastric emptying is due to nerve damage, particularly the vagus nerve, which is responsible for controlling stomach muscles. When this nerve becomes damaged, the muscles can no longer contract effectively, leading to a delayed digestion process. This condition not only causes discomfort but also complicates blood sugar management. Since the stomach empties more slowly, food is absorbed into the bloodstream at an unpredictable rate, often leading to sudden spikes in blood glucose levels. To manage gastroparesis, it's important to adopt dietary changes. Smaller, more frequent meals are recommended to avoid overloading the stomach. It's also essential to reduce high-fiber or fatty foods, which slow down digestion even further. Medications like metoclopramide can help stimulate stomach contractions and improve digestion, but it's crucial to work with a healthcare provider for proper guidance. I once worked with a patient who suffered from frequent nausea and unpredictable blood sugar spikes. She had been diagnosed with gastroparesis after months of feeling unwell without understanding why her blood sugars were so erratic. After adjusting her diet and introducing medications to help with digestion, her symptoms improved dramatically, and her blood sugar levels became more manageable. It was a life-changing experience for her and a reminder of how important it is to listen to your body and seek professional help when something feels off. 2. Frozen shoulder, more than just joint pain. Many people experience shoulder pain at some point, but for those with diabetes, it can be a warning sign. Frozen shoulder, or adhesive capsulitis, is a condition characterized by pain and stiffness in the shoulder joint. Although it can affect anyone, those with diabetes, especially those with fluctuating blood sugar levels, are more likely to develop it. The exact link between diabetes and frozen shoulder remains unclear, but some theories suggest that chronic inflammation and changes in the blood vessels may play a role. Over time, these factors can contribute to stiffness and pain in the shoulder joint. If you're experiencing shoulder pain that doesn't seem to improve, it's important to see a healthcare professional. Physical therapy focusing on stretching and strengthening exercises can significantly improve mobility, while medications can help manage pain. Controlling your blood sugar is key to preventing or reducing the risk of frozen shoulder, as well as reducing the severity of the condition. 3. Pruritus, itching, a symptom often overlooked. Pruritus, or itchy skin, might seem like a minor concern, but when it's persistent and widespread, it could be a sign of diabetes. In diabetics, elevated blood sugar levels often result in poor circulation and dry skin, making it more prone to itching. Additionally, diabetes can make individuals more susceptible to yeast infections, which can also lead to itching. For those dealing with itchy skin, it's essential to stay moisturized. Regularly applying creams or lotions can help combat the dryness. Managing blood sugar levels is also crucial, as controlling glucose levels can prevent numerous skin complications. One example I recall is a client who constantly complained of itching all over his body, especially on his arms and legs. He had no idea that it could be connected to his blood sugar levels, as he had no other symptoms of diabetes. After a routine checkup, it was revealed that his blood sugar was consistently high. He began to manage it more effectively, and the itching gradually subsided. It was a powerful reminder of how diabetes can affect the skin in ways that are not immediately obvious. 4. Erectile dysfunction, a sign you shouldn't ignore. Erectile dysfunction, ED, is another symptom that can be linked to undiagnosed diabetes. While ED is often seen as a standalone issue, it's important to recognize that in many cases, it could be an early indicator of diabetes. High blood sugar can damage blood vessels and nerves, which in turn can impair erectile function. For men who experience ED, it's essential to prioritize strict glycemic control and work closely with a healthcare provider. Managing blood sugar levels is the first step, as this will help prevent further vascular or nerve damage. Additionally, there are medications, such as sildenafil, Viagra, or tadalafil, Cialis, that can help treat ED. However, addressing the root cause, uncontrolled blood sugar, is key to long-term relief. One of my patients was embarrassed to discuss his issues with ED, but after we discussed the connection between his condition and potential diabetes, he decided to get tested. Sure enough, he had undiagnosed diabetes, and after he started controlling his blood sugar, his symptoms improved. It was a wake-up call for him and an important lesson about the interconnectedness of health issues. 5. Hearing impairment, a surprising link to diabetes. Hearing impairment is often overlooked in the context of diabetes, but recent studies suggest there may be a connection. Sustained high blood sugar levels can negatively affect the nerves and blood vessels in the inner ear, leading to hearing problems over time. For individuals with diabetes, regular hearing evaluations are essential to detect any hearing loss early. Additionally, diligent blood sugar management can help protect the delicate structures of the ear. Protecting your hearing by avoiding loud noises and wearing protective ear gear is also a good practice for those at risk. I recall a patient who came to me with increasing difficulty hearing in one ear. He had been living with type 2 diabetes for years, but never considered hearing loss as a possible complication. After undergoing a hearing test, it was confirmed that his high blood sugar had impacted his hearing. It was a difficult reality to face, but he began working on controlling his blood sugar and saw some improvement in his hearing. This experience underscores the importance of monitoring all aspects of health, not just the obvious symptoms of diabetes. 6. Skin tags, a sign of insulin resistance. Skin tags are small, benign growths that often appear in areas where the skin rubs together, such as the neck, armpits, or under the breasts. While they are generally harmless, an increase in skin tags can indicate insulin resistance, a precursor to type 2 diabetes. Anyone noticing more skin tags should consider getting screened for diabetes or prediabetes. Maintaining a balanced diet, exercising regularly, and managing stress are important lifestyle factors that can help reduce the risk of developing insulin resistance. If the skin tags become bothersome, a consultation with a dermatologist may be necessary for removal. A friend of mine noticed more skin tags developing as she entered her 40s. After learning about the potential link to diabetes, she decided to check her blood sugar. She was diagnosed with prediabetes, but with changes to her lifestyle, she was able to reverse the condition and prevent it from progressing to type 2 diabetes. 7. Periodontal disease, a warning for your overall health. Periodontal disease, a severe form of gum disease, can be an early indicator of diabetes. Elevated blood sugar levels can impair the body's ability to fight off infections, making diabetics more susceptible to gum inflammation and oral infections. Over time, this can lead to tooth loss and other serious oral health issues. Good oral hygiene, including regular brushing and flossing, is essential for diabetics. Additionally, regular dental checkups are necessary to catch any issues early and prevent complications. Managing blood sugar levels is equally important, as it can help reduce the risk of developing periodontal disease. One of my clients experienced gum issues that wouldn't improve, despite regular brushing and dental visits. When we addressed her uncontrolled blood sugar, she was able to see significant improvement in her oral health. It was a reminder of how diabetes can impact even the parts of the body we don't always think about. Conclusion: don't wait, act now. These 7 surprising signs of diabetes serve as reminders that the condition can affect many parts of your body in ways you might not expect. The earlier you recognize these signs and seek medical advice, the better equipped you'll be to manage the disease and reduce the risk of complications. Whether it's through regular checkups, making lifestyle changes, or strictly managing your blood sugar, taking proactive steps can make all the difference in your long-term health. If you've noticed any of these symptoms in yourself or someone close to you, it's important to act quickly. Early detection and intervention can prevent serious health problems down the road. Lastly, I encourage you to subscribe to this channel for more helpful tips on managing diabetes and staying healthy. Don't forget to share this video with your loved ones to help spread awareness.